A lot of adults find themselves having quiet conversations with themselves about a substance. It might be alcohol, weed, or prescription pills. The dialogue usually happens late at night, and it is almost always private. Eventually, those internal questions collide with a cultural narrative that insists you must place yourself into one of two rigid categories. The first category demands that you reach a catastrophic rock bottom. The script here is well known. You must check into a 30-day inpatient rehab facility and commit to absolute, unyielding abstinence for the rest of your life. The second category is equally severe. If you decline the rehab path, if you feel your situation does not require blowing up your daily life to go to a facility, society assumes you are simply in total denial about having a problem at all. Millions of people live in the massive gray area between those two extremes. They stay stuck there, paralyzed, not because they are lazy or unwilling to change, but because they are exhausted by the options and ashamed of the label. There is a massive statistical anomaly in how we view addiction, and it directly contradicts what most of us are taught to expect. The vast majority of adults who meaningfully change their substance use do so without ever stepping foot inside a rehab clinic or attending a traditional 12-step program. They achieve real recovery through other routes, engaging in therapy-led behavior modification, building strong social support networks, or utilizing self-directed reduction plans. Realizing that an inpatient facility is not the sole avenue for change strips away the heavy shame associated with asking for help. It means you can fix the problem without adopting a label you do not recognize. To understand how alternative routes work, clinical therapists shift their focus away from the substance itself and look instead at the psychological purpose it serves. In clinical terms, a substance is rarely the core problem. It is a tool hired to do a specific job. That job might be quieting severe anxiety, dulling a persistent depression, or numbing the sharp edges of trauma. This diagram illustrates co-occurring conditions. An underlying anxiety or depressive disorder is the rule. If treatment ignores these pulsing conditions, the original job remains unfulfilled. They continue demanding a solution, guaranteeing the cycle of substance use expands. Long-term recovery holds firm only when a treatment plan addresses the visible behavior and the invisible psychological root at the exact same time. Treating those roots allows for goals that look very different from the traditional rehab model. One of the most effective paths is called moderation management, an evidence-supported clinical approach that focuses on controlled reduction. While absolute abstinence is absolutely the correct and medically necessary goal for certain patients, the data shows it is not required for everyone to achieve health and stability. Look at this split bar chart. It shows what happens when we listen to the individual. When a patient's personal preference aligns with the specific treatment model they receive, their likelihood of clinical engagement and long-term success dramatically spikes. Therapists achieve this customization using specific tools like cognitive behavioral therapy for substance use disorders, or CBT-SUD, and motivational interviewing. These methods help patients build their own boundaries rather than having rules imposed upon them. Replacing a rigid, shame-inducing mandate with a compassionate, highly tailored goal removes the emotional roadblock that prevents so many people from seeking care in the first place. Recovery is a highly customizable spectrum, a long continuum of options rather than a cliff you jump off. On the lower intervention end of the spectrum, care might simply look like self-directed reduction strategies paired with weekly therapy to untangle those root causes. The middle of the spectrum incorporates formal moderation management plans and dual diagnosis therapy, carefully balancing mental health care with substance monitoring. And the high intervention end remains a vital resource, offering absolute abstinence protocols and inpatient medical care for those whose physical safety requires it. Understanding where you fit on this continuum puts the power back in your hands. You can initiate real, measurable change without fearing that the first step will disrupt your entire life. Even knowing that, picking up the phone to call a therapist today might still feel like too large of a leap. If you are not ready for a conversation, you can use the free, anonymous 2-minute substance use screener available at Coping and Healing Counseling's website. The screener relies on validated clinical questions to give you a private, objective read on your current severity level. It helps pinpoint exactly where you currently stand on the recovery continuum. If you are in Georgia and decide you do want to talk, Coping and Healing Counseling provides a secure safety net. They offer a diverse team of licensed therapists through a fully HIPAA-compliant telehealth platform, accepting major insurance, and offering $0 Medicaid copays. The middle path exists, and you do not have to walk it alone. A private 2-minute evaluation is the easiest, lowest-stakes way to figure out what, if anything, to do next.